Thank you for joining. I'm Elizabeth Willett, Senior Herbalist with the Natural Fertility Company. We're the naturalfertilityshop.com and naturalfertilityinfo.com. And today we're going to talk about when you are having a fertility health issue and or struggling to try to conceive, and when it's time to go to the doctor. We frequently receive emails and communication from a lot of different people about certain symptoms and things that they're dealing with that really truly should be evaluated by a doctor, or you should be seeing a doctor to determine what the cause is. They're really the best person to help figure that out. And by doctor, I really mean healthcare provider. This could be your medical doctor or your naturopathic doctor, your herbalist perhaps. If you work with a doula or a midwife, if you're to that point, certainly reaching out to them, and or a therapist if your issues are emotionally related to emotional health. So when do you see a doctor? If you've been trying for pregnancy for a year or more and you're under the age of 35, now is the time to go in to see a doctor or a specialist to see if or what might be preventing pregnancy. Sometimes things can be found, oftentimes. There are some times when nothing can really jump out or be found to be standing in the way. Some of you may have heard of unexplained infertility, and that often is the case. They just really can't find a cause, hence unexplained. If you're over the age of 35 and have been trying to conceive without success for about 6 months, it would be time to go in to see a doctor. So going to see a doctor or a specialist. Your doctor, your gynecologist may not know how to run all of the tests that a fertility specialist or an endocrinologist would know. There are times when an endocrinologist will refer on to a reproductive endocrinologist will refer on to a reproductive immunologist. So there are lots of different people, lots of different specialties, lots of different specialists out there. Most people do start with their primary healthcare provider, whether that's a family doctor or an OBGYN, and do some basic testing, and then depending upon what is found, they will ask for or be referred on to an endocrinologist of some sort, or a specialist in a different area, depending upon what is found. So what do you see, or what do you experience, or how do you know when to go in beyond age and trying without success? If you have a history of health issues or a familial or hereditary issues that you think might be standing in the way of your chances of conception, or that could be related to some fertility-related symptoms that you're feeling or experiencing, you could consider going to the doctor. Symptoms that you notice that you can't identify a cause of on your own. A lot of us are very in tune with our bodies and what's going on, but sometimes you just don't know why something is happening, particularly pain. If pain is disrupting your life, your lifestyle, making you not feel like you, it's time to go figure out the cause of that pain, and a naturopath or medical doctor is the person to help you do that. Chronic or repeated poor immune health. That would be another thing. Sudden loss of libido. If it's, it's just something that just completely goes away. You're completely uninterested in trying to conceive anymore, and you can't really figure out why. That might be something to go talk about. It could be physiological or psychological, emotional. Keeping in mind that women's libido does wax and wane throughout the menstrual cycle. You're going to find that you have a heightened libido, and that's a good thing, during your fertile window or when you're ovulating. That's your body saying, it's time to try to make babies, so let's do this now. And then your libido might wane off, and you may not be as interested in intercourse towards the end of your cycle and when your menstruation is about to start. If you have very low body weight, this could mean that you're not making enough hormones, or on the flip side, if you're obese or your body weight is higher, you could be making too many hormones. Obesity, like I said, that is, if you feel like that might be standing in your way or causing fertility health or fertility-related issues, it's time to go talk to someone about that and how to move forward and begin lowering your BMI or body mass index. If you've had an invasive medical treatment that could have impacted or led to impacted your reproductive organs or damaged tissue, you may want, even if it was years in the past, and it could potentially be related, you may want to talk about that or be examined to know if that's something, if there's something going on. If you're planning a medical treatment and you're worried about the treatment and how it could impact your fertility health in any way, do talk to that with your doctor about that. Ask those questions. You're entitled to know, and you're entitled to know all of the potential side effects, even understanding that not everyone experiences those lists, but you should talk to your doctor about it if that's weighing on your mind. If you've had any injury or trauma throughout your body that could have affected your brain, your hormonal system, your reproductive organs that you think might be standing in the way or causing a problem, go talk to your healthcare provider. If your periods are absent, particularly absent month after month after month, if you don't have any cervical mucus at all, this is of course for women, if you have large blood clots during menstruation or really heavy menstrual bleeding, even PMS symptoms that are off the charts, over the top, uncontrollable, you really can't help them in any way, whether it's herbs or natural therapies or even over-the-counter pain medications. If you use those things, if you've got PMS that's uncontrollable, it's time to go talk to somebody about why that's happening. If you've had repeated miscarriages or pregnancy losses, oftentimes doctors will want women to have 3 losses before they'll send you on for testing. If that does not sit right with you, advocate for yourself for testing when you feel right, or ask for a second opinion. Go seek a second opinion or ask for a referral. Advocate for yourself. If you've had repeated losses, it's time to go to have some additional testing to see what might be standing in the way. And it could be female or male factor related. It could be from either partner. So you would even want to probably think about having your husband or partner have some testing as well, maybe. What else? Pain, burning, bleeding that's more than spotting during intercourse. Any of those things would indicate there's probably something a little bit off. Maybe be time to have some sort of evaluation from your doctor. If you know your diet has been poor, highly processed, high in sugar, alcohol, caffeine, it's time to first change your diet, but you might want to seek support from a nutritionist or a dietitian, or even anyone who can help you with changing your diet, figuring out how to eliminate those things that could be harming your fertility health. There are counselors who can help you kick addictions if caffeine or smoking is an addiction for you. But there are people out there who are trained to help you through those things, and they have great tips. So it may not necessarily be your medical doctor in that case, although your medical doctor may be able to refer you on to a specialist if you want it to be covered under your insurance. You'd have to check all that out. I'm not saying insurance covers, or all insurance will cover things like this, but anyway, think about those things. If you've had chronic or long-term use of medications or drugs, whether those are over-the-counter or recreational, we know these to impact hormonal balance and or sperm and egg health. So if you have used a lot of over-the-counter drugs or recreational drugs, and you're not able to stop, it's time to seek support and figure out how to cut back and stop those. Emotional health related things. This is just as important as anything physical that shows up. If you have removed yourself from your life, social events, you've stopped participating in or working on any hobbies that you used to love, if you've lost interest in being with your friends and even maybe spending time with your partner, if you've lost interest in your family or distanced yourself from family, if you find yourself wishing ill on other pregnant women when you see them or hear of their success, if you've lost interest in your partner, of course, all of those are signs that it's time for some emotional support, and that's completely okay. There are therapists, there are counselors, there are herbalists who work on emotional health, all sorts of different kinds of professionals who can help you deal with those emotions, because they're almost just as harmful as some of these other things that we talk about on a more regular basis. If you have repeated emotional outbursts and breakdowns and you feel you have no control over them, it's time to go seek some help for that emotional issue. If you have chronic stress and you're struggling to deal with that chronic stress, it's time to seek ways to help yourself or find someone who can help you understand various ways to do that. Try a few things. Find some tools that will work best for you. If you're depressed, if you find you're dealing with depression or uncontrollable anxiety, it's time now to go get some emotional support and start working on that. Or if you have low energy all the time, that might be emotional or physical. So it's time to go talk to somebody about that. If you suspect or have any of the risk factors that we've just talked about that may be a sign of infertility, it's very important to seek a professional support. We have information at our fingertips 24/7. I understand that. I understand that a lot of you have seen a lot of doctors and aren't really into going to one more specialist, making one more appointment, getting in to see one more person. But it's really important to have professional help. These people are trained, including the herbalists on our staff. We are trained in our knowledge area. We may have some tools that you can't find just by searching the web or don't happen to find by searching the web that may be helpful. And sometimes talking through the issues is the first step and the most freeing first step. Getting stuff off your chest, things that are weighing you down. While your family doctor might be able to start with initial testing, I kind of touched on this in the beginning, they aren't going to do the same tests or have the capacity to do the same tests as a specialist, a fertility specialist, or a reproductive endocrinologist, or a reproductive immunologist. These people have even more specific skill sets and testing criteria. So you could start some basic testing with your doctor, but may need to be referred on if you're not finding anything through that excuse me, an initial visit with your general practitioner, your OBGYN. Even if you choose medical treatment, which is completely fine, there are infinite ways to support your body and your fertility health naturally. We talk about them regularly here. We've got lots of information on our websites. You can find this information in multiple places. But you can be doing things at home and with your diet and lifestyle particularly, and managing your stress without a prescription and alongside any medical treatment. And if you're curious if something might fit into your particular situation and your story, please do reach out to us for support. That's what we're here for. And I should add as a little bit of closing note that everything I've talked about today can impact men and women. There are some things, obviously menstrual cycle related, that aren't going to be related to male fertility, but emotional health is just as important for a man as it is for a woman. And we know that this journey can be just as trying for many men who are dealing with male factor infertility, but who may not be, but who are watching their wives and partners really struggle and taking that emotion on and feeling the weight of that as well. So if you're in a place where you're thinking maybe it's time for help, professional help, it probably is time for professional help. And I hope that you feel empowered to go get that help that you need. So I'm going to call it good and say goodbye. So I hope you have a great weekend. Thanks for joining me today, and we'll see you next week. All right, bye-bye.